Total knee replacement is one of the most cost-effective and consistently successful surgeries in orthopedics. It provides reliable outcomes for patients suffering from end-stage degenerative knee osteoarthritis. It can alleviate pain, restore function, and lead to an improved quality of life. There are three major parameters that decide the outcomes of total knee replacement.
So there are three variables. One is how you are approaching your knee, whether you are cutting too much of muscle or not. Second is what type of implant you are using. Third is the rehabilitation program. This is the thigh muscle which is present in front, is called a quadriceps muscle. This muscle has got a very good function of making you up and down the stairs or getting out of the chair. 90% of people cut this muscle to go into the knee joint. Whereas we do not cut, we put a small cut in front of the knee, only cut this part of the capsule which covers the bone, and then we invert this patella, we do not cut any muscle. This is called a subvastus approach or MIS, or in full form it is called minimal invasive surgery. What is the advantage? We are not cutting your thigh muscle. So the patient can get out of the chair on day 2 and start walking and start climbing stairs and do squatting and cross leg sitting. Second thing what we do is an implant which we use. The implant has got, one is the design, other is the material that is used. Front of the thigh bone, it should be very thin so that the patella can easily move around. It's called patella friendly implant. Second is, it has got a center radius, and this implant has got more radius, 7 radii, so that your flexion and that is called bending and straightening is easier, and it is more anatomical, that means normal. Third thing is that the most important part is the joint is high flex. That means this implant has got allowing you to bend your knee beyond the flexion that you get out of the chair or sitting in the chair. That means you can do squatting and cross leg sitting. Normal implant also, if you do exercise, you can do it, but it gets spoiled over a year. Whereas this implant is designed to withstand excessive bending like in squatting or cross leg sitting, and still will be lasting for more than 30 years. Third is that we make the patient rehabilitation program. We do not say to the patient that you need to do more exercises, only 2 to 3 weeks of good exercises. Patient is allowed to sit cross leg, patient is allowed to climb stairs, patient is allowed to do squatting, and patient is allowed to walk as much as possible in 1 to 2 kilometers within 3 to 4 weeks. As much as possible, as much as his age allows. So that is the rehabilitation program.